Knock, knock, knock. I'm gonna wash my hands. Hi, Mr. Schmidt. This is Caroline, neighbor. I'm going to be your nurse for today. How are you doing? Great. The reason I'm here is to do a head to chest assessment. It's going to take me roughly 20 minutes. Is that okay with you? All right. Before we start, I just want to find out from you two identification, your name and your date of birth. Awesome. Are you in any pain? Are you allergic to anything? Great. We're just looking at the patient. The patient is not in any distress. The patient is alert, oriented, knows where they are, which is the place and the time. So I'm going to start by looking at your skin. The skin is proportional to the race. Oops, it's falling. The skin is appropriate with the race. I don't see any lesions. All right, it's looking. Okay. All right, the next thing that I'm going to do, I'm going to check the head. And what I'm checking on the head, I'm going to check to see if there's any lesion on the head. I'm going to also check the hair to see if there's any infection on the scalp. And I don't see any infection on the scalp, and I don't see any lesion in the head. So the next thing that I'm going to check is going to be, since I'm already in the head, I'm going to check, their face. I'm going to check their ears. So I'm looking at their face color is appropriate with their skin. I don't see, in their face, I don't see any distress. And also their face is symmetrical. And then for their ears, I'm checking to see if I could see any lesion in their ears. Or I could see any drainage. I don't see no drainage in their ear. I could use a pin to look too. There's no drainage. I don't see any drainage. So the next thing I'm going to do is to check, to check their eyes. Looking at the eyes. I'm looking at the conjunctiva. And the conjunctiva is pink and it's moist. And I'm going to check the sclera. It's white and moist. So the next thing I'm going to be doing is I'm going to check their mouth. I'm going to check their lips. I'm going to check their tongue. And I'm going to check, their gums. I'm going to use light. See their lips, their tongue, and their gum is pink and moist. So that means it's all okay, it's normal. Then the next thing I'm going to do is check their nose. They don't really have a nose, but I'm going to pretend here. So I'm going to press on one side of their nostrils. I'm going to press on the other side of the nostrils. And what I'm checking to see is the potency. And they all look good. It's all normal. And and with their nose, I'm going to check to see if there's any drainage. I don't see any drainage in their nose. Okay, the next thing that I'm going to do, I did check their head, I did check their face, I did check their mouth, I did check their nose, and so everything is good. So the next thing we are going to be doing now is I'm going to check, their neck. So what I'm going to check on the next, I'm going to check their carotid pulse, which is, I'm going to start on the right hand side. And I'm going to do the same on the left hand side. And I'm checking to see if their pulse is normal. So their pulse is within the normal range, which is from 10 to 20. The next thing I'm going to be checking is going to be the vein, the jugular vein. And I'm just going to observe the vein. The vein is going to be, the outer one. It's going to be right here, running right across the neck, right here. And I see that the vein, there's no distinction in the vein. So it all looks good. Okay, so now what I'm going to do, looking at them, looking at all the accessory muscles, they all look good. And so I'm going to check the different lobes. I'm going to oxytate. I'm going to use my diaphragm, and I'm going to start on the left hand side. And I'm going to start with the left upper lobe. Then I'm going to move to the right upper lobe. I'm going to do the left lower lobe. And I'm going to do the middle lobe. And I'm going to do the left lower lobe. And I'm going to do the right lower lobe. Okay. After I've done that, I'm going to use a bell, and I'm going to do the same thing. So I'm going to do the left upper lobe, because the left has just two lobes. So it's going to be the left upper lobe and the right upper lobe, the left lower lobe, the right middle lobe, the right lower lobe. Okay, so once I've done that, I'm going to turn the giraffe, and I'm going to do the posterior. So I did the anterior, and before I turn the giraffe to do the posterior, there's one section I forgot about: the anterior and the posterior dimension or diameter. The anterior and the posterior diameter is greater than the transverse diameter, which is 2:1. And then the next thing that I'm going to do is I'm going to turn them around so I could do the posterior. Do the same thing. I'm going to oxytate. Going to be the left upper lobe, the right upper lobe. Then you have the left lower lobe. You have the right middle lobe. And then you have the right lower lobe. Then, since on the right hand side you have 3, I'm going to turn them around again. sorry. And so this is the right hand. So under the armpit right here, I'm going to open. So this is going to be the right upper lobe, the right middle lobe, and the right lower lobe. Then on the left hand side is going to be the left upper lobe and the left lower lobe. Okay, great. So I'm going to check the radius on the pulse. Looks normal. I'm also going to check the temperature using the back of my hands. Our normal temperature is 96.4 to 99.1. And he is at the normal range. And the last thing I'm going to check, the Weber sound, which means their hearing. And I'm going to use this pen here. I'm going to tap onto it, and I'm going to put it in between the head, the middle of the head. And that's going to Weber testing for the sound, the hearing. Okay, and I'm going to do the same thing. I'm going to tap. I'm going to put behind the ear, which is going to be the bone vibration. I'm going to tap again, and in the front is going to be the air vibration. If it's normal, the air vibration is always going to be greater than, the bone vibration. And then going down the list, the nails. Well, he doesn't have nails, so I'm going to use my nails. And I'm going to check for the color of my nails, which, looking at it, is going to be pink. And I don't see any clubbing. And I'm going to check for the capillary refill. I'm going to press on in my nails. And the capillary refill, is 1 to 2 seconds refill. So that's pretty good. And I think that's the end of my head to chest assessment. Thank you so much. Schmidt, I'm going to lock your bed, and I'm going to put down your bed, lower your bed, and I'm going to give you a call light just in case if you need anything. Can I get you something to drink? You need a pillow? Are you in any pain? Great. Thank you so much. I really appreciate you choosing a hospital. If you need me, just again, this is the call light. I'll just put it right here. Just give me a call. Thank you again. And I'm going to wash my hands, the last hygiene.